in this video. Hi viewers, myself Vishant. In this video, today we are going to see an overview of neurotic disorders. So before going to these neurotic disorders, I just wanted to differentiate what is psychosis and neurosis. Then we'll move to the various conditions of neurotic disorder. So if you come to the psychosis, we can say it is one of the major psychiatric disorder, and there will be psychotic features. Psychotic features in the sense the patient will be having hallucination, that is the imaginary perception, and there is a delusion, false, unshakable belief. But if you come to the neurotic condition, we can say it is, while comparing with the psychotic condition, it is a minor disorder, and the patient will not be having any type of psychotic features, that is the hallucination and delusion. And if you see the prognosis, the recovery rate, if you come to the psychotic condition, the recovery rate is very poor, but in the neurotic condition, the prognosis is very good. And another important feature with the psychosis and neurosis is nothing but in the psychotic condition, the patient may not be having the reality or insight. But if I come to the neurotic condition, the patient knows that I'm having certain problem. Exactly 100% he may not be knowing all the symptoms, but still the patient knows that I am having certain issues or certain problem. So now we'll see what's a neurotic disorder. So while coming to the neurotic disorder, we can say it is a group of psychiatric disorder, and we can say that it is a minor disorders and without certain intense psychopathology. But welcome to psychotic condition, there is an intense psychopathology will be there. And moreover, in the neurotic condition, the anxiety, it is one of the major reason for neurotic condition. And the term neurosis, which is coined by William Cullen in the in 18th century. Now we'll see what are the common neurotic conditions. So if you come to the neurotic condition, it may be anxiety, phobic anxiety disorder, OCD or obsessive compulsive disorder, then dissociative conversive disorder, and somatoform disorders. Now we'll see just an overview, means each disease condition. Detail we cannot go, we'll just go through the meaning and what are the important types. So first we'll move to the anxiety disorder. So the anxiety, everyone knows what is an anxiety. Anxiety, we can say that it is a feeling or it is an apprehension towards anticipating a danger. One simplest example, if you say the students, they are declared that there is a university examination by next month, or after 2 weeks there is a university examination. So automatically what will happen? The students will develop with the tension and they will start to study. So that we can see this is a form of anxiety. But sometimes what happens, this anxiety will become very intense. They cannot control their tension, or their tension they cannot control. So that we can say it is an anxiety disorder. Clear? And if you come to this anxiety disorder, mainly there will be a generalized anxiety disorder and there is a panic attack. If you come to this generalized anxiety disorder, towards almost all the activity, we can say it is one of the persistent and a chronic type of anxiety, we can say. And usually there is a criteria, it should be minimum last for 6 months to 2 years. Then we can say it is a generalized anxiety disorder. And if you come to the panic attack, the panic attack is nothing but it is a sudden and intense fear or sudden and intense anxiety. And here what happens, generally the patient will be thinking that, oh, I am going to die. That is intense fear or intense tension will come. So that is a panic attack. Now move to the next condition, that is a phobic anxiety disorder. In a simpler way, we'd say it is a phobia. So by hearing phobia, everyone think that it is just a fear. It is not just a fear. We can say it is an intense form and it is an irrational fear. Why we say it is an irrational fear? Without reason, the person will be having a fear towards certain situation or towards certain object. Then we can say it is a phobia. And if you come to this phobia, there are mainly 3 types of phobias are there. So we'll see what are those. First one, it is an agoraphobia. So in this agoraphobia, you can see that the person will be having a fear or irrational fears to going out or being in a public places, open places, that we can say it is an agoraphobia. Come to the next one, social phobia. In the social phobia, the person will be having an irrational fears to be in a public places and doing activities among the public people, means public people or in a outside. If they are having a fear, especially like a stage fear, all these things we can say it's a social type of phobia. And there is one more phobia, that's a specific phobia. In this specific phobia, the person will be having fear towards certain specific object or specific situation, like a fear of height, fear of animals, that we call a zoophobia, fear of blood, fear of water, like that specific object or situation the person will be having a fear, we termed as a specific phobia. Now we'll move to the next condition, that is the OCD. We call it as obsessive compulsive disorder. If you come to this OCD, again there are two terms are there, obsession and compulsion. Obsession is nothing but it is a repeated image or ideas or feeling which will comes to patient's mind or which is intruded into patient's mind, we can say obsession. So if you come to this obsession, there are certain obsessional ideas will be there, like orderliness, or it may be related to the contamination, or it may be related to the arrangement, doubt, religion, sex, like that certain obsessional ideas will be there. And this obsession idea, the anxiety will be increased in patient's mind, and it will be followed by certain repeated compulsive activities, what we call as a compulsion, obsessive compulsive disorder. Obsession, only obsessive ideas will be there. In the compulsion, the obsession ideas will be followed by certain repeated or stereotyped behavior, we can say compulsion. So here you can see the person maybe checking their purse frequently, or if they go outside, they'll lock the door, they'll be checking. Normally 2 or 3 times we'll check whether we have closed our door or whatever. But these person continuously, they'll go out, they'll come back, they will open their door again, they will go and check whether I have locked my gas cylinder or I have off my gas cylinder, or whenever go outside, frequently they will check their purse whether money is there or what, or if they touch somewhere, they'll be frequently they'll be going for a hand washing, or 10 to 20 times they may be taking a bath daily, or daily 2 to 3 times they are washing their toilets, like that. So many compulsive behavior will be there. So that we can say it is an obsessive compulsive disorder. Come to the next type of disorder, it is nothing but the dissociative conversive disorder. So if you come to this dissociative conversive disorder, here what happens? There is usually a dissociation and there is a conversion. In the dissociation, or a dissociation will say that the person will be dissociate. That means the person separate from his original behavior, or from oneself or himself, he will be separated. That we'll see what it is. Then there is a conversive disorder. Here the physical symptoms may be converted into, the psychological feeling or his anxiety may be converted into physical symptom. First we'll move to the dissociation. In the dissociation, again there are certain types will be there. Here we can observe, because of the anxiety, from the original self the person may be deviating. So we'll see what are those. First one, it is a dissociative amnesia. Dissociative amnesia is nothing but the person may be forgetting, or there will be inability to recall his certain personal events. Then there is a dissociative fugue. Dissociative fugue is nothing but the person will be having a wandering tendency. Then there is a dissociative trance. That is nothing but during certain religious ceremony, there is a dance-like behavior will be there. Then there is a multiple personality. That means the person from original personality, he may be changing into some other type of personality. The multiple personality will be there. So these are the certain dissociative features we can say. And in the conversive, we can say that because of the anxiety, it may convert or it may changes into his physical symptoms. That may be like we can say the person may be showing certain paralysis feature, breathing difficulties, or like that certain symptoms will be developing. So this is the dissociative and conversive disorder. Moving to the next one, it is nothing but a somatoform disorder. In the somatoform disorder, again, like in the conversive disorder, the patient will be having different types of what we can say physical symptoms. Sometimes more than one type of physical symptoms will be there, and there is an absence of organic pathology. Means if you go to the lab investigation, it says that clearly, completely the person is normal, but still the person will be having one or the other type of physical symptoms. That is termed as a somatoform disorder. In the somatoform disorder, again, we can observe there is a conversive disorder, and we can say there is a somatization disorder. Somatization disorder is nothing but the person will be having more than one type of physical symptoms will be there. And usually the somatization disorder, there is a criteria, diagnostic criteria, it should be last for at least 2 years duration. Then we consider it as a somatization disorder. And if you come to the one more, hypochondriasis, what happens? Most of the person may be misdiagnosed it as a delusion. A delusion, everyone knows it's a false, unshakable belief. But in the hypochondriasis, what happens? The person will be having a preoccupation with a severe or major illnesses. If some of the minor symptoms the patient develop, he may be think that, oh, I am having very severe illnesses. If the patient is having, one example, if you say, if the patient is developing with some of the chest pain, due to it may be due to sometimes pyrosis means like a burning sensation in the esophagus, but the patient think that, oh, I am having angina pectoris or I am having myocardial infarction and I am going to die. So like that, the certain symptoms will be developing in the hypochondriasis. So that these are the what we can say important type of neurotic disorder. So now we'll see some of the simplest or basic management for this neurotic disorder. So in the neurotic disorder, the main treatment in the physical treatment will go to the psychopharmacology. In the psychopharmacology, the main drug of choice will be anti-anxiety drug, especially the benzodiazepines. That will be the drug of choice, like diazepam, alprazolam. These are the major drug of choice in case of neurotic disorder. Apart from this one, we'll be going for minor dosage or low dosage of antidepressant drug we can administer to the patient. Then there are certain psychosocial therapies. In the psychosocial therapy, we can go for the psychotherapy, supportive psychotherapy, individual psychotherapy, and in the behavior therapy, like certain behavioral techniques are there. Systematic desensitization will go, means step by step patient's anxiety will be reduced, and certain behavioral modification we can apply for this particular patient. So these are some of the important treatments of neurotic condition. So today we have seen regarding what is neurotic disorder and what are the common or major neurotic disorder, and we have seen the management of neurotic disorder. So that's all for today's class. In later videos, we'll go detailing regarding each condition. Thank you for watching this video. This is Vishan signing off. Thank you.